On behalf of my co-authors, I'm Loretta Nostapil from the University of Texas MD Anderson Cancer Center, and I'm presenting the results of a phase 1 novel combination of Ublituximab, Umbralisib, which is a PI3 kinase delta inhibitor, and ibrutinib in relapsed refractory non-Hodgkin lymphoma, or CLL, at the 2017 annual ASCO meeting. This is a multi-center, standard phase 1 study with a primary objective to identify the safety of this novel combination. As I mentioned, Ublituximab is a chimeric anti-CD20 antibody that binds a unique epitope on CD20. It's being combined with Umbralisib, which is a more selective PI3 kinase delta inhibitor, and ibrutinib, which is a BTK inhibitor, in relapsed refractory non-Hodgkin lymphoma in CLL. It's important to note that the study was also amended to include treatment-naive CLL patients. This was a standard 3+3 design. It's also important to note that the Ublituximab had a flat dose of 900 milligrams. The Umbralisib was dose escalated, starting at 400 milligrams up to 800 milligrams, and the ibrutinib was standardly dosed according to histology. For instance, for CLL, it was dosed at 420 milligrams, and for non-Hodgkin lymphoma, 560 milligrams. It's also important to note, according to the study schema, that Ublituximab continued up to 12 months and then stopped, but Umbralisib and ibrutinib continued as tolerated or until disease progression. As mentioned, the primary objectives were to determine the safety as defined by the maximum tolerated dose of the combination, with secondary objectives to assess the efficacy, including overall response rate, time to response, duration of response, and progression-free survival. The key eligibility criteria, again, included patients with relapsed or refractory non-Hodgkin lymphoma subtypes who had had at least one prior line of therapy, and CLL patients, including those who were treatment naive. In regards to the results, the demographics demonstrate that we have 38 patients evaluable for safety, 36 evaluable for efficacy, with a median age of 65. There were more male patients of 29 versus 9 females. There were more CLL patients included, with 20 CLL or SLL patients, 6 large cell, 6 follicular, 4 mantle cell lymphoma, and 2 marginal zone lymphoma patients. ECOG performance was most commonly 0 or 1, but we did include 3 patients with an ECOG of 2. The median prior lines of therapy were 3, with a range of 0 to 6, and more than half of patients had had at least 3 or more lines of therapy, and 39% of patients were refractory to rituximab. Again, with the primary endpoint being examination of safety, we have listed out the most common adverse events occurring in at least 20% of patients, most of which were grade 1 or 2. Common adverse events included diarrhea, fatigue, nausea, cough. It's important to note that the grade 3 or higher adverse events were infrequent, as outlined in the table, but notable that 18% of patients had grade 3 or higher neutropenia, 8% thrombocytopenia, and 11% pneumonia. 1 patient discontinued therapy early as a result of sepsis. The median duration of therapy is 11.1 months, with more than 80% of patients being on drug beyond 6 months of therapy. Thus far, the overall response rate for the entire cohort was 83%, but also notable that 100% of patients with either CLL, marginal zone, or mantle cell lymphoma have responded, with 6 of 19 patients with CLL achieving a complete response. Also notable were the fact that 1 patient with large cell lymphoma achieved a partial response. 4 of 6 of the large cell lymphoma patients were of the non-germinal center subtype, and 50% of the patients with CLL had either 17p or 11q. In conclusion, this novel combination appears to be associated with a favorable toxicity profile, with more than 80% of patients having at least 6 months of drug exposure. The efficacy also appears to be quite notable, with CRs achieved in patients with CLL with this novel combination. The toxicity profile of the PI3 kinase delta appears to be one that will pair favorably with combination therapies in an attempt to overcome mechanisms of resistance. And additional studies are planned to identify how this combination will move forward. We appreciate your time and attention on this interesting novel combination.